Hello, my name's Sophie Hasty and I'm the Parent Education Midwife at Swift, also known as Warwick Hospital. This virtual presentation is about perineal massage and it's part of the Path to Parenthood series of virtual presentations. Please be aware that this virtual presentation contains a diagram of the genital, vaginal and vulval area and a drawing of a woman doing perineal massage to herself. If you think that these pictures might upset you, this might not be the right presentation for you to watch. So in this virtual presentation, I'm going to explain the anatomy of your body, that means the structures of your body around your perineum and your vagina, why you should do perineal massage, what perineal massage is, how to do it, when to do it, and who should do it. This diagram shows the anatomy of your body around your vagina and perineum. So you can see that the perineum is the area of skin and muscle between the back of your vagina and your anus, which is also known as your back passage. When you give birth to your baby, your perineum has to stretch a lot and often it will tear or need to be cut. Research studies have shown that if you massage your perineum in the last few weeks of your pregnancy, it is less likely to be injured, especially if you are older than 30. Massage may also reduce pain in your perineum after birth and the chances of you suffering from incontinence. Massaging your perineum is thought to make the skin and muscles softer and stretchier. This means that it is easier for your perineum to be stretched by your baby's head rather than torn, and it may allow you to consciously visualize your perineum and then relax it, which makes it easier to push your baby out. Perineal massage has been shown to reduce the likelihood of you experiencing a large or more complicated tear to your perineum or of needing an episiotomy by 16% if you're a first-time mum. An episiotomy is a cut to the perineum which is done because the midwife or doctor caring for you assesses that it is necessary to allow your baby to be born. In second-time mums, there is less evidence that it reduces the likelihood of tearing or episiotomy, but the research indicates that these mums experience less pain in their perineum in the 3 months after giving birth. The evidence to suggest that performing perineal massage reduces incontinence of urine or faeces is less clear, but it does indicate there is a reduced likelihood of being unable to control passing wind. You can start massaging your perineum from 34 weeks of your pregnancy. We recommend that you do it for about 5 minutes at a time every 3 or 4 days. You can do it yourself, or if you feel comfortable with this, your partner can do it for you. You may want to start out doing it yourself, and as you become practiced and comfortable at it, you could ask your partner to take over. Massaging during or after a bath may be helpful, as the warmth and water will dilate the blood vessels, making the perineum softer. Make yourself comfortable in a place where you feel warm, relaxed and safe. You may find it helpful to have relaxing music playing. Lying back, propped up on pillows with your legs drawn up is an ideal position, or you could stand with one leg propped on a chair. It's easier and more comfortable if you use an unscented oil such as sunflower or grapeseed oil, or a lubricant such as KY jelly. There are specific oils marketed for perineal massage, but these are not thought to have any advantage over any other oil or lubricant, and they're very expensive. Make sure your fingernails are short and clean, and if you haven't just had a bath, wash your vulva and your bottom before you start. Go to the toilet before you start. If you are doing the massage yourself, it is probably easiest to use your thumbs. Use plenty of oil or lubricant and then put your thumbs inside your vagina up to the second knuckle. Your fingers should be on the outside skin of your perineum. You may find using a mirror the first few times helps you work out what you are doing. If it feels too difficult to reach, then experiment to find what feels easier for you. You can try just using one hand, swapping to the other later, or using your forefinger and middle finger. But they need to be palmed towards your bottom, so this is a rather tricky twist. You can also try different positions, lying back supported by pillows, in the bath, standing with one foot on a chair and reaching round behind you. Play around and experiment. Massage the inside of your vagina by pushing down and away from you in a sweeping motion until you can feel the stretch in your perineum. Move your fingers and thumbs against each other in a massaging motion through the skin and muscle of your perineum, and move this pressure through the whole perineum and out to the sides to include your labia in the massage. You should feel some stretching and perhaps pressure, but it should not be painful. Aim to do this for about 5 minutes every couple of days from 34 weeks of your pregnancy. While you are doing the massage, try to relax your perineum and visualize your baby stretching it rather than your thumbs. When you are giving birth to your baby, you will then be familiar with this feeling and have practiced relaxing your perineum, which will be really helpful to you. If you ask your partner to do the massage for you, they should use their forefinger and middle finger inside your vagina, with their thumb applying the counter pressure through the outside of your perineum. It's advisable not to massage your perineum if you have any sort of vaginal infection, such as thrush or herpes, or any heavy vaginal discharge. Or if your waters have broken. It's really important actually that you don't do it if your waters have broken. Also, don't do it if you find it extremely painful. And actually, if it is unduly painful, it's probably worth having a chat with your midwife or your GP about that. I hope you have found this useful. If you would like any more information, the next slide will list some of the references I've used to make this virtual presentation. Thank you for watching.